What's up, Guerrilla Social Workers? Welcome to the Guerrilla Social Work Podcast with your host, Jeff Hot Tamale Moore, and yours faithfully, Mace Warren. Jeff and I are both licensed clinical social workers who specialize in providing forensic psychotherapy to clients involved in the criminal justice system. We truly enjoy the work that we do. We love sharing our insights with you, and thank you so much for your ongoing listenership and subscriptions. This episode of the podcast is brought to you by Alpha Counseling and Treatment. Alpha Counseling provides clinical services, case management, and peer support for justice-involved clients, including substance use, sexual offense, and all other court-ordered clinical care. Today's episode, Jeff and I talk about the latest news in sex offender issues and treatment. We revisit a topic about more inclusive language associated when working with this population, as well as proposals to change this language altogether. And we get into the implications this has for our field as well as the public as a whole. We hope you enjoy the episode. All right, and we're live.
Oh, yeah.
Live as it's going to get. Fresh off the training, behavioral management training once again. Yeah. Dude, it's always kind of, I don't know, it's weird going from group to group when we're doing those trainings. Mm-hmm. Just for those of you who don't know, Jeff and I do behavioral management training occasionally, and we've done it for a couple of different programs that work with youth, right?
Yeah. I think like 3 now.
And it's always a different crew just based on like even geography from city to city who tends to be more engaged and willing to kind of like, because willing to take in some of the concepts. You know what I mean?
That's what I was trying to, do you think it's geography? But when you and I were talking, like consistently one city continually performs better than the others. Is that because of geography, or is it just the right people happen to be in place in like supervisor roles?
Well, maybe. I mean, I don't know, but it always seems like Southern Utah has like, I don't know, just people who just tend to be a little bit more, have a growth mindset about what's kind of going on, you know, not kind of like a fixed way of looking at it. So, but yeah, it's always, because it's, even, well, I've seen this too. I shouldn't say it's limited to just like, even with, like therapists, professionals in our field that they do training, you know, when we're working with like University of Cincinnati or anybody for that matter, and they're coming up with, you know, they're bringing up these research and this and that, and it's just so funny when people are like, you don't know what you're talking about, you don't do the work that I do. And I'm like, well, they have the research to show that of people who do exactly the work that you do, and that this is what's known to be effective, and yet you're resisting those things. Like, where does that come from?
I think pride.
Yeah.
Yeah. I mean, like, because I've felt that internally, and I've had to like push back against myself. Like, for example, you personally are responsible for my growth through the whole denial and empathy being, so.
But what's prideful about that? You didn't invent those terms.
Well, which is how I was able to bypass it. Okay. But you know how it is though. Like if you have a belief about something, it becomes a part of your identity. And then it's like if you've spent time and energy acting upon that belief, then if you're looking at it wrong, which I think a lot of people do, they look at it like they've been wasting time or they've been doing something wrong, rather than just sitting back and being like, oh, okay, well, looks like I need to revise my beliefs if I want to continue doing what is now shown to be the best thing. I think people don't do that thought process, and so they just project their shit all over the place.
Yeah, it's weird because I guess my mindset of it is anytime there's an advancement in our field clinically, like I'm excited about that. That's kind of cool. And if it's and honestly, it's like if the research supports it, and even if it's, you know, different from what I'm doing, like that should be something you should get jazzed about, right? Like I don't know why you'd hold on to things that only you believe is to be true as effective and whatnot.
Well, what would you like? You champion cognitive behavioral therapy about as long as I've known you as a therapist, and just. If a new wave of research came out that showed that equine therapy was the way to treat sex offenders, don't you feel like you'd feel a little bit of like skepticism or like, I don't know. What do you mean CBT doesn't work? You're telling me that lifting a horse's foot is going to help these dudes not molest folks?
Yeah. Okay. Well, if it's that outlandish, I think I would be skeptical. But I think then if you like just gave me the data and said, you know, like how when we're in a training, and it's not just like a journal or a news article or one study, it's like a meta-analysis, you know, a study of studies, and every single one of them come back with the same conclusions. Well, I guess I'd eat crow at that point, you know, I'd have to, because that's kind of what, and I did that a little bit, you know, when we kind of like, the ways that I was originally taught how, you know, sex offender treatment is supposed to be done. And that was from primarily like other therapists who'd already done it. And maybe they just were going by what they thought were, you know, the ways to go. And that's all passed down through generations or whatever. But then I found out that substance use and sex offender treatment, cognitive behavioral therapy is where it's at. You know, that's where you're going to make your most inroads. And then I didn't really resist it. And I guess intuitively, CBT has always made sense to me.
Yeah.
Like it just tends to make more sense. So yeah, when you're talking about like, I mean, nothing against equine therapists, if there is such a thing. I'm just saying that like connecting the dots with, you know, in equine therapy, saying that, you know, this, I can really connect the dots in CBT, like taking a client from point A to point B all the way through them getting better. And I know how that's going to work, but you'd really have to sell me on the equine. Like, you know, like that seems like there's some magic involved in that, you know,
but
which maybe there is, I don't know.
If you were provided with enough evidence over time across studies, you'd come around on it though, which that's the reasonable position to have. And like today, when we caught some resistance or some flack from the staff that we were trying to teach this stuff to, I doubt that the people giving us flack have really bothered much to like do some, I wonder why I'm reacting this way. What's causing me to push back again?
They're not personal inventory.
Yeah. I don't think they're doing that.
Yeah, probably not. Yeah.
It doesn't fit the mold with what they think works, and so they're going to reject it.
Well, and I guess, you know, I'll give you an example of one. What are you doing with my kid's Lego, dude?
Breaking it.
He built those for me. He's like, here. You know, one of the ones that and I think people have done a better job explaining it to me, and then I've read up on it. And, but initially, like one of those that have a lot of research that wasn't really explained to me very well was like EMDR. That was explained to me. And I said, well, why does that work? That sounds a little hokey. And the answer I received was, it just does. And I'm like, well, that's not good enough.
That doesn't cut the mustard for me either.
Even if you did give me research and didn't give me like an explanation as to why it worked, I'd still have a hard time with it, I think. Yeah. And I did. And then some people explained it. Like Matt, I think when we interviewed with Matt, he did a pretty good job of explaining EMDR kind of in a succinct way. And then I've had other therapists explain it to me, and I was like, oh, okay. I mean, I'm not going to start training in it, but because there's just as much evidence to say that CBT is useful for trauma as there is, for EMDR, but I'm not going to knock it anymore. I've gotten away from that. I mean, it's still kind of witchcrafty, but hey,
I know,
witchcrafty ain't bad, I suppose.
Yeah, I guess if it works, proof's in the pudding.
Yeah, that's awesome. So yeah, I'm kind of excited about this episode. We haven't done a news reel here in a long time. Right?
Yeah, exactly.
Yeah. So we were going to talk about what are some trending topics in the world of sex offense news, as I hope all of you subscribe to on a pretty routine basis, by the way. Oh, yeah, and we had a bunch of new subscriptions this last week. That was pretty cool.
Hey, beautiful.
I know, right? Several of them are my students, but hey.
We'll count it.
Right? What can you do?
Yeah.
So what are you, what's your story today is kind of going back to something we talked about last time, right?
Yeah, from the episode LGBT ... P. Yeah.
We had a Q in there too somewhere, right?
Yeah, I think so.
Yeah.
It kind of, the whole idea was that pedophiles are trying to tag along with the LGBTQ movement,
right,
and to add themselves along as a viable sexual orientation. So yeah, it is kind of a addendum, I guess, to that.
Right.
And this article that came out. It's a
universe. So how did you find out about it first?
Podcast.
Okay, you were listening to a podcast?
Yeah, podcast. And the podcast I was listening to was definitely railing against the idea that so the idea here is that MAPS, M-A-P, minor attracted person, it's kind of a dressed up, I guess, politically correct name for somebody that has pedophilic interests. And the idea behind calling them MAPS is to destigmatize it and allow for people that have attraction to children to not deal with the social stigma and to have it be more accepted. And so, predictably, the most people's take on that is to push back entirely, because I think what happens is that people, we're going to get into this in a minute because I have a kind of a complex take on it, but I think a lot of people's initial reaction is thinking that this is a way to usher in pedophilia through the door. It's a way to normalize it and make it okay. Any attempts at allowing for any normalization of anything having to do with pedophilia is a slippery slope to full-scale endorsement of it.
It's almost like if you said that is stigmatizing language, somebody's damn right. We are trying to stigmatize that, and so you might see some initial dude. Also, isn't MAPS that same? Isn't there some place that's using mushrooms for PTSD and
multidisciplinary something of psychedelic research?
Can you, man? That's a bad Google search.
Super
somebody's like, oh yeah, I really want to look into this MAPS thing for my PTSD. Like, what the
wrong kind of mushroom?
Oh boy. Well, hopefully, so minor attracted person is what we're talking about.
Yeah.
Okay. All right. So let's see. We got an article from the New York Post. It says, and so this says, professor placed on leave after saying sexual attraction to kids not always immoral. Okay, so this is fresh. November 17th. This is 2 days ago.
Yeah.
A Virginia University. That's written weird. A Virginia University. Look at that.
Yeah, that is weird. Right in the caption above, Old Dominion.
Yeah.
Look up above.
A Virginia. No, a Virginia. Okay, I got it. A Virginia University. Oh, I'm an idiot. A Virginia University has placed an assistant professor on administrative leave after the educator sparked heated backlash for saying it isn't necessarily immoral for adults to be sexually attracted to children. Alan Walker, who teaches sociology and criminal justice at Old Dominion University, made the controversial comment while discussing minor attracted persons and pedophiles during a November 8th interview with Prostasia Foundation, a San Francisco-based child protection organization. Walker, who uses the pronouns they, them, was discussing their book, A Long Dark Shadow of Minor Attracted People and Their Pursuit of Dignity, when they insisted it's important to use that terminology instead of pedophile because it's less stigmatizing. In a statement Tuesday, the school said it placed Walker on administrative leave. So it looks like we got a little bit of a video queued up here.
Yeah.
Let's give it a whirl here.
So my first question was, even the title of your book is pretty controversial, right? Because the subtitle is Minor Attracted Persons and Their Pursuit of Dignity. And many people are concerned that the designation of minor attracted persons, or MAPS, suggests that it's okay to be attracted to children, or they're worried that the term suggests that pedophilia is a sexual orientation, which they worry is a slander on LGBT people. So could you talk about why you used that term in the title and throughout the book?
Absolutely. And thank you so much for that question. I use the term minor attracted person or MAP in the title and throughout the book for multiple reasons. First of all, because I think it's important to use terminology for groups that members of that group want others to use for them. And MAP advocacy groups like Before You Act have advocated for use of the term MAP. They've advocated for it primarily because it's less stigmatizing than other terms like pedophile. A lot of people, when they hear the term pedophile, they automatically assume that it means a sex offender. And that isn't true, and it leads to a lot of misconceptions about attractions toward minors. I've definitely heard the idea that you brought up, though, that the use of the term minor attracted person suggests that it's okay to be attracted to children. But using a term that communicates who someone is attracted to doesn't indicate anything about the morality of that attraction. From my perspective, there is no morality or immorality attached to attraction to anyone because no one can control who they're attracted to at all. In other words, it's not who we're attracted to that's either okay or not okay. It's our behaviors in responding to that attraction that are either okay or not okay.
Okay, let's just...
lot to take apart there.
Yeah. So, I mean, I kind of get the gist of it, but I mean, you thought you had some thoughts on this or a point to it.
Yeah. So what's this person's name? Alan Walker. Mm-hmm. All right. So I'm following along with Alan here on some of this, but I can see how Alan's getting backlash from everybody. So look, like, first and foremost, like 100% against anything having to do with acting out sexually towards children, like 100%, obviously. And I think that when people hear somebody like Alan talking about this, they think that they're trying to kind of make it okay or usher that in, or at the expense of hurting pedophilic people's feelings, that it's like, well, you know, I think people make the mistake of thinking that Alan here is saying it's better to cater to pedophiles' feelings than it is to make the overarching goal to combat against child sexual abuse. And I don't think that's what Alan's saying.
Well, right. But, and the weird part about this is like, even as you say that, like, what a disclaimer. Like, nothing that comes after that disclaimer is going to be well received.
Nope.
First and foremost, I want to make sure that everybody knows child sexual abuse is you know, we don't tolerate that. Like I'm not supporting this. That being said, it's like almost like at that point, it's like, oh, okay, here we go. What's next? You know, what's coming out of this dude's mouth
People
next? So
already stopped listening at that point.
Right. They're like, oh, here we go. So it's definitely an uphill battle when you're kind of doing this, but like, so kind of aware of why the backlash is happening. Mm-hmm. And I mean, and again, it would be an idea to what degree do we have a growth mindset about this, that we're willing to kind of look into this and say, okay, well, really what's Alan talking about in this circumstance? So you're not necessarily well, I don't know. Are you agreeing, disagreeing? What do you kind of see where Alan's coming from? But.
Yeah, the part where I think Alan went wrong here is saying that that having pedophilic interests isn't a moral issue. So look, like morality, I mean, morality is basically like a set of ideas and standards that people in a society agree upon so that we can all live together and cooperate and exist. That's like what morality is. And a lot of times, it's
almost like that quote that morality is more about conformity than it is about like I can't remember what the quote was, but we have our own laws and rules that govern our behavior, and we conform to that because it's like, okay, yeah, I can buy into that. It makes sense.
Well, and a lot of times that means that you set aside your personal interests or what you want right now for the greater good of society as a whole. That's conforming, right?
Sure, yeah.
And so I don't think that it's a morally tenable position to say that having, that endorsing pedophilic interests can be considered moral. It's certainly not acting on it. And I think that's where Alan here has drawn the line, is saying that acting on sexual interests against children is really bad. obviously. And I think Alan's trying to make it so that they're not outcasted as much. And then, but here's the thing. It's like, this can kind of go one of two directions. And I'm curious where you land on this. Like if left unchecked, and if there's, whether it would be like actual physical locations or just, forums on websites or whatever it is for people to talk without a governor on, about deviant sexual interests. There's going to be enough. You and I have worked with enough dudes over the years that when they were at their worst, when they were at their most deviant, they would have, fired off each other. They would have, it had gone a really dark spot. It would have been encouraging sexual abuse against children, or, even just saying that's not so bad. You'd hear people kind of getting some groupthink on a lot of this stuff we've heard pedophilic people say about, well, in ancient cultures, it was fine. The Greeks did it. Other countries, you'd hear a lot of that stuff. And, that's where you get into a lot of the really dark stuff that Arlo on our podcast was against, a lot of trading, child sexual abuse stuff, images around. But like on the other side of things, this is where I think that what Alan's saying has some merit, is what you and I do for a living is reactive. It's always after the fact, right? And we're dealing with, sexual abuse once it's already happened. And I've had a lot of clients, and I'm sure you have as well, that have said something like, God, I wish I'd had this treatment beforehand, but I didn't feel like I could reach out. I didn't feel like, and I would have been rejected if I'd have let people know I was struggling with this shit. And they're right. They would be in a lot of cases. And it's, I think there's a lot of people in our field, even fellow therapists, that if a pedophile that had not acted on it yet, had said that they had these interests, like a lot of therapists, alarm bells would go off, and I think they'd have a tough time in therapy. And if there were a way to destigmatize things, at least to the point that people were able to get together in some type of a support group facilitated by somebody that wasn't just going to let it go unchecked and, just off the rails talking about whatever. It was clinically guided by like one of us. We could teach these dudes the same skills that we teach people that have already offended before the fact. And, with sufficiently motivated people that realize that acting on it is really screwed up, but don't want to be rejected and cast out into the dark shadows of the netherworld for having the attraction. Like if they could learn those skills ahead of time, I mean, maybe they don't act on it. Maybe like actual sexual abuse theoretically goes down.
So you're saying, in other words, if what Alan is saying is true, and that the use of the terminology like minor attracted person reduced stigmatization of that group of people that pedophilic that have pedophilic interests, that the likelihood of them otherwise seeking treatment to address those issues might increase, and,
right.
And if that increases, then the prevention of future child abuse sexual victims could be that could also be increased. There could be a correlation between non-offending pedophiles that have come into the system that are seeking treatment, and that correlates with a reduction of victims over time that would have otherwise been victims. Okay.
Good synopsis. Yeah.
Well, here's what I was thinking about this is it's a unique look at sexual attraction compared to maybe how sexual attraction's been looked at previously. So let me give you an example, and this is not an apples to apples comparison, but, think about like, okay, if I just look at sexual attraction in general, who I'm sexually attracted to, and there have been responses to that in the past that a lot of us have been really critical about. So, for example, let's say my morality, going back to the morality, is linked with a particular religion, for example, and that religion's, prescription on morality disagrees with anything like homosexual, right? And yet I have same-sex attraction, okay? And this is where the whole, like, there's several documentaries on this. I don't know exactly which ones. I don't want to throw out the names and misquote them, but I've watched them where, people will go for like, to pray the gay away, essentially, that whole, that whole cliche.
Accountability buddies.
Yeah, accountability buddies and trying to get rid. And now we look on that. Now, however long ago that was, people look at that and they are like appalled by it, and maybe rightly so. I mean but the reality is that person in some ways is pretty conflicted. Okay, and the track has been. I think without knowing context, what's happening there, I think the track has been, well, no, they should just embrace their sexuality. And if they have same-sex attraction, so what? Which, by the way, I totally agree with. The problem is the individual. The individual is conflicted because they have a belief in this, moral prescription that's given to me by my religion that maybe I'm very devout to, and yet I'm having same-sex attraction, and then there's a lot of conflict internally there, and helping them resolve that. So just saying no, just be gay and be happy. Okay, I think that is a way of saying I'm okay with you being gay, and so you should be okay with that. And the guy's like, well, no, I'm not okay with it, and the reason why is because I believe in this, but I also have these feelings about this, right?
Right.
Now. So in that regard, we've been much more receptive to the sexual attraction piece and tried to embrace it, right? So that's kind of where a lot of people's mentality goes when it comes to sexual attraction that's not just heterosexual attraction. Now, when you start talking about pedophilic attraction, you can't really go in that direction. Nobody's going to be like, yeah, you just embrace it, bro. Like nobody is going to go in that direction, right?
Right.
And rightly so, because now we're encouraging otherwise like illegal type of behavior. So and moral or immoral starts to be this is where it starts to be kind of problematic. And this is why I would say the moral point to this, sometimes my obligation as a therapist is to provide empowering my client with skills and attitudes and a thought process that's going to enrich his lifestyle and improve his lifestyle, right? His or her lifestyle, not cause more problems. Does that make sense?
Yeah.
So I can't having them embrace that. I'm also getting to the point where I'm having them embrace an attitude that could possibly lead to illegal activity. Now, it's not necessary. So of course I want to do that. So that's what I'm saying is this is illegal behavior. This is like me. And again, not an apples to apples comparison, but just recently here in Utah, we were able to, like I had anything to do with it, but in Utah, they legalized marijuana on a medical side, right? Which is kind of nice from a therapist because I talk to my clients so often about marijuana, and, they make pretty damn good arguments about why weed is better for them, compared to like Xanax or something like that. But I had to harken back to always, well, yeah, but it's illegal. And unfortunately, if you keep using it, it's going to cause problems in your life. It's going to lead to more dysfunction over time. Mm-hmm. So the counter, I think, to that would be that's not that what Alan is saying, that embracing pedophilia as a lifestyle, but just making it less stigmatizing. But I think you'd have a hard time convincing the general public that you're not embracing it to some degree. And at the end of the day, it's always going to be illegal. It's always going to be harmful.
As it should be.
No. And to Alan's credit, going back to the point where never ever should this be like condoned to act upon this behavior.
Right.
That's never right. But
which I think Alan said.
For sure.
Yeah.
100%. So I'm not trying to take words out of context. I'm just saying that I don't know how you I don't know, you are kind of validating and simultaneously working on them not acting upon, a way of you know what I mean? Like you're it's like moving in both directions at the same time.
You're okay, but not really.
Right.
Yeah.
Right.
It's like we're cool with not what you're doing.
Right. I mean, I definitely can get on board with the idea that I don't think anybody has a crystal clear explanation as to why adult men and women have attraction towards, children. I don't think anybody has a great explanation for that. And I think the explanations are as vast as the type of, people.
I've heard a lot of reasons.
Right. So So I don't know in terms of accountability if this is one of those nature versus nurture things, or if you can just draw it back to like, well, this is just how they were born, or this was reinforced over time, or anything. I don't know if you can. I have no clue. I mean, I don't think anybody really has an answer to that, right? And just throwing out because they're sickos, that doesn't help. Okay,
Right.
I also don't know how much it matters either. Like, so if nobody knows, then how much does that matter? And so I think it's okay to validate that they're experiencing those thoughts and that those thoughts are distressful, and what can we do about those thoughts? I think that's important because, and to that end, I do agree. I think that if people had a forum in which to discuss this in a way that they're not just going to be cast out and they're actually going to be able to get some help, we might be able to increase the likelihood that they seek treatment prior to offending, which the damage is already done at that point. You know what I mean? So back to kind of your point was, how can we do that? But I don't know. I mean, yeah, how do you validate something that you know is not only illegal, but nobody's ever going to get on board with?
You know, I'm trying to think of like comparisons, and everything I'm coming up with falls short. Like I was almost going the route of like, well, to help people understand what it might be like to have an attraction that you didn't want to act on. And, you know, your example of, you know, the religious dude that wants to follow his religious convictions, but, you know, is homosexual, he's dealing with that conflict. And, you know, our job as a therapist is to help them achieve their goals. And then I was thinking, well, like, what about maybe dudes that are trying to work on, like, you know, maybe like a serial philanderer, you know, like a dude that he wants to stay married, he wants to stay loyal to his wife, but he's constantly running out, you know, cheating on her, all these different things. And, you know, there are people that meet together, you know, Sex Love Addicts Anonymous, whatever it is, that their goal is to remain married, and yet they are constantly compelled to cheat and to, you know, get laid or whatever it is. But that metaphor doesn't work either, because that's not illegal or necessarily harmful in the same ballpark as child sexual abuse. It's not even in the same.
Right. You can place a value judgment on that behavior if you want, you know, and say, I mean, you can have an opinion about it and say, I don't think you should, you know, be doing that while you're married or whatever. Yeah. Okay, that's fine. You have an opinion about that, but there's nothing illegal about it. I mean, and spare me the adultery piece. I mean, I know that's legal.
It's illegal
I know,
in 40 states.
Yeah, SWAT team ain't going to come in and arrest somebody for hooking up with somebody. I mean, what at the end of the day? See, this is why I said it's not an apples to apples comparison. Right. I was simply saying that the way we've addressed what other people have thought of kind of like as a sexual attraction that would be considered outside of the norm, the way that's been handled in the past, most of us look back on that and say that's just really, I mean, a lot of people would say it's bigoted, you know,
the stigmatizing of it.
Right. Yeah. Right. And so the reason I mentioned, like, you know, religion and homosexuality is just because that's one that people have been referred to treatment for. And some people, I think, genuinely have a conflict there, you know, when they're having to do that. And again, I can validate both sides at that point in therapy. I have no problem validating the fact that somebody has same-sex attraction, but they also want to be devout to their, I don't like that client coming in to me. I wouldn't just start shitting all over their religion. You know, that's not what I would work on. I would help them resolve this internally.
Yeah, you'd be out of line.
Right. So this is the dilemma, though, is I can't, it's difficult for me to validate like sexual attraction towards children as a, I guess, a functional sexual attraction. It's a dysfunctional sexual attraction.
Right.
Like, it will only lead to problems in their life. So any exploration of that, and this is what some people don't understand, is like, okay, well, are there ways that they can engage in that they can reinforce in a legal way? And the answer is, by and large, no. I mean, other than just using your imagination, which a lot of people do, right? I don't think many people are aware of this, but let's say I drew a picture. I just hand drew a picture. And let's say I was a pretty good artist too. And I hand drew a picture of me engaging in sexual activity with a child. What would I then be in possession of?
Well, child pornography.
Right. It's illegal to do that. You're not allowed to do that. Like you cannot do that. You cannot depict this in virtual reality. You can't have any depictions of these things if you're using them for sexual purposes. So there's no way on this planet, well, at least in our country, there's no way to engage in this behavior in a legitimate legal way to reinforce the behavior. So that's why I'd have a hard time validating that and then helping a client like explore how to, what to do about this.
Well, right. As far as the validation piece, so you've had clients that have pedophilic interests that, aside from being in prison for it, justified it and were just fine with it. They know they would make arguments for it. But I bet you've also had clients that wish to hell that they didn't have that arousal.
Oh yeah, for sure. And I don't think that they wanted to make arguments for that.
Right. And so it's like, I think the and I don't know what it would look like because I'm still trying to work it out myself, but I think the benefit is for those guys to like, okay, for a person to be able to come forward with, and be able to say like, all right, I've got this problem. I've got this arousal. I'm a good person. I know that if I act on this, I won't be being a good person. I'll be causing damage. I just don't want to feel like alone. I don't know where it came from. I don't know if I was born this way. I don't want it. I don't know where it came from. And that person exists. And there's a lot of people that feel like they're the only one that has this, what must feel like a curse, because I think like I don't have any say over my sexual orientation. And like, lucky me, I'm straight. And so society's been pretty kind with that. I like adult women.
Have to put up with nonsense.
Yeah, exactly. And I think like how much value I get out of my relationship with my wife, and I just get to thinking like, damn, like what if my entire orientation, or I won't call it orientation, just I was aroused by kids. Like that would be pure hell. Yeah. And
knowing what you know about,
knowing what I know,
right. Being an adult heterosexual male, like that would be pure hell.
It would be pure hell.
Right.
And, I wouldn't want to act on it, but that would feel lonely. I'd feel like a freak. I'd feel like something was wrong with me. If I didn't feel like other people understood my position, it would be easy to be like, man, what's the point? People get suicidal, and then some people kind of develop a case of the screw-its, and they act on it anyway because there's kind of like a why not piece. And I just wonder if enough of those people that know they shouldn't feel that way were able to say, I dealt with it too. And similar to like a person that's 20 years sober and, Alcoholics Anonymous being like, yeah, I know what it's like. Here's how I got through it. And, that would give people a chance to be like, okay, I know I have these interests. I probably need to not be a scoutmaster. I probably need to not work in a nursery. Yeah. And
so essentially you'd be teaching them like almost like
treatment
prevention techniques from getting into high risk situations where engaging in that behavior is higher. And the other thing I think is worthwhile is exploring the idea. See, this is where I don't know if anybody would have okay, as opposed to treatment, but like how back in the day, if I did have same-sex attraction, the idea would be to get me into a relationship with a lady, or something like that. I don't know if people would be opposed to trying to reinforce what we would consider like normative sexual attraction with somebody on this end. Like I think people would be a little bit more open to that, because a big tenet of CBT as well is I can't simply just eliminate the unhealthful thought process, like the ineffective way of thinking. I can't just eliminate that. I have to replace that with new and more effective ways of thinking. And so, I've always kind of been a believer of, your sexual interests don't necessarily change over time; they expand. And by expansion, I mean I've kind of always been interested in girls, right? And I think I started noticing interest in girls maybe 13, 14, before then they just had cooties and whatever. But that doesn't mean I'm interested in 13 and 14-year-olds. It expanded by virtue of I got older, my peers got older, and I naturally started to become more attracted to same age peers and older peers as a result of my sexuality expanding, my sexual. So I think like anybody with pedophilic interests would also have that. So to the degree that this would invite more people into exploring it in that direction, like, okay, can we help you with prevention strategies that teach you about high risk situations and triggers both internal and external, and realistic and effective ways of managing those, while at the same time helping you kind of bolster more healthy ways of sexuality, whichever direction you choose at that point. I think anybody can get on board with that, right? But man, I just don't know if it's wrong, morally wrong, on our end to stigmatize that. I mean, think about it like this.
You're saying it's not more. Say that again. It's not morally
I don't think
wrong.
It's morally wrong to stigmatize that behavior. That's stigma suggests that there's like a kind of natural apprehension or negative sentiment towards that behavior, right?
Should be, yeah.
And I think that's
It's a
okay,
good thing. Yeah, it's a
right?
good thing.
I think that's okay. And like you said, if I just woke up tomorrow and I started having sexual attraction towards kids, I'd hate it, right? Because of the stigma. Like that's where, when I'm saying validate, I'm not trying to say like I condone it or endorse it. I'm just saying if it would be difficult to, like, I think Alan's being accused of normalizing it, which I don't think that's what Alan's doing. What I think rather is that, if we can encourage people who are experiencing that for whatever reason to seek treatment as a means of prevention, everybody pragmatically should get on board with that. Like you make that argument to say, look, we know statistically that cognitive behavioral therapy is effective at treating this subgroup of a population of clients. And right now we're all reactionary. So the only time these people come to our attention is after they've committed a sexual offense. What if we made treatment a little bit more inviting and less like, attack oriented or confrontational oriented, such that these individuals would be willing to seek this treatment prior to them committing an offense? I don't think anybody would disagree with that at that point.
I don't think so either. That conversation is really hard to get off the ground, though, for the reasons that we just talked about. It's tough to get people to tune in to a conversation long enough to be able to articulate everything you just said to arrive at that piece. And because you talked about, he said, I don't think it's wrong to stigmatize that behavior. And I agree. And especially when we're talking about behavior. And when you were also talking about that sexual attraction expands over time, I don't have the numbers on this. It's probably pretty easy to find, but I mean, most people that have pedophilic interests seem to be non-exclusive pedophiles as opposed to exclusive pedophiles.
Meaning that they have attraction towards adults as well.
Correct.
Yeah.
Do you know the numbers on it?
No.
Okay.
No. I'm sure. Here, let's let me look that up.
Yeah, look it
Keep
up.
Going.
Yeah. So I mean, if I have a client, but actually, now that I'm thinking about it, a lot of my clients that sexually acted out or sexually offended on children also happened to oftentimes be married at the time, to an adult, male or female. They had a history of age-appropriate consenting relationships, and then also, in addition to that, happened to have pedophilic interests. And there's been a handful. I can think of. I mean, I know what I'm offering right now is anecdotal. You're busy right now looking up the actual numbers, but
I got you.
Yeah, anecdotally, I've had maybe a couple clients is all that were exclusive pedophiles, and that their attraction was only to children under the age of 11. And so if we're looking at the sheer numbers of it, and we're able to see that, okay, whatever percent of people with pedophilic interests are non-exclusive pedophiles, that's where a treatment program like ours could really make a difference in, maybe teaching these dudes the social skills needed to land a date with someone their age. Because again, how many of your clients have been the type of guy that they they end up offending on somebody younger because they have no game with someone their age, and the person they end up sexually acting out on is younger because they're easy to manipulate.
Right.
You know.
Right.
You get somebody with social skills or whatever it is. You got something for us?
Not really. I mean, it's not giving me sheer numbers, but it does say, I think, speaking to your point, this was from let's see. So the journal is Law and Human Behavior, and the article was titled Predicting Reoffense in Pedophilic Child Molesters by Clinical Diagnosis and Risk Assessment. This was published in 2015, and here's kind of the headline. Indeed, the subcategory of exclusive pedophilia turned out to be of particular salience in the present study, with rates of sexual recidivism being approximately 5 times higher, 21.2%, among exclusive pedophiles compared to the group of non-exclusive pedophilic men. So in other words, like those, I mean, it's not speaking to the numbers, but going to your point, though, I think my direction would essentially say, well, yeah, if it's not exclusive, then I would simply talk about, prevention strategies for addressing the deviant sexual behaviors and thoughts, and then reinforcing and supporting the healthy sexual behaviors. And then the tendency is that they're not going to have, I mean, that would just suggest that that's the track to go, is I'm not going to have nearly the rate of recidivism at that point because I have options. I have options to.
That's what those numbers show.
Right. See, and this is why I don't think we should get too wrapped up in the idea that this is something comparable to something like treating, again, when somebody was seeking treatment for homosexuality versus religion or whatever, homosexuality is perfectly healthy. There's nothing necessarily wrong with that on a moral level or on a just a physical level. But this, on the other hand, is illegal, and most would therefore identify it as being immoral. Right. So we have to have other options that are more functional for the client. I mean, that's the number one thing, because it can't just be, especially for clients that come to us, it can't just be about, well, because this is the right thing to do. Nobody listens to that. It's what are my other options? And so even with exclusive pedophiles, I think you would have to move it in another direction. You'd have no choice, because if the only option is this, that again takes away from a central tenet with CBT is, I'm going to help you address your unhealthy behaviors and ineffective ways of thinking, but I'm not replacing them with new, more effective ways of thinking. And if you don't do that, then you're only getting half the...
That's a tough one.
Right. You're only getting half the stuff. So, yeah, I guess to be continued. I wonder I'm kind of curious what's going to happen with this
me too.
Alan Walker.
I think Alan... Not that Alan's going to listen to Guerrilla Social Work podcast, but I think the mistake was bringing morality into it and trying to normalize it on a moral level.
Right.
People will react to that on a visceral level, as do I. You know, it's immoral, but like enough people that have pedophilic interests don't want it. And the numbers that you just read, that non-exclusive pedophiles reoffend way less than exclusive pedophiles, show that presented with options, which is where you and I come in, then that they wouldn't they wouldn't offend to begin with, maybe, if they didn't feel like they couldn't reach out. So yeah, to be continued.
Yeah. And this kind of goes into this this story that mine's more of a kind of so I've always thought, I bring this up in my classes a lot. My students will appreciate this. So have you ever noticed that when a word, we were talking about the word relapse, okay? And the proposal at one of the places where the students was doing their internship was, let's not call it relapse. Let's call it reoccurrence of use, which, or sobriety, period of abstinence, right? I'm like, okay. Or addiction, substance use disorder. Okay. So I'm just pedophilia, minor attracted person. Do you kind of get the trend here? Like, I don't understand when you make something more politically correct, why do you have to add more syllables to it? Like, I'm burning more calories doing this.
Language.
If you went the other direction and made it shorter, I swear more people would buy into it.
Yes. And I know I'll let you run with this, but just language has a purpose, and it's to convey ideas. efficient language conveys ideas in as succinct a way as possible. And so, yeah, if we're looking for a way to communicate ideas, and if we're trying to change people's minds on a different way to communicate ideas about something that maybe needs to be dressed up in a politically correct manner, I think the direction that you're about to take it is perfect, because we're talking about efficiency of language, efficiency of words.
If I say minor attracted person, it takes me a beat. Like, because I'm saying, like, are you minorly attracted to me? Like, you know, like, or are you attracted to dudes who?
Are you like? It's like, does that mean you're kind of attracted, like minorly?
or are you attracted to dudes that get coal and dig out coal from the
minor?
earth?
Yeah. Like, I guess they're rugged, you know.
I mean, you know, that's. I'm just saying, you know, it could mean a bunch of different things. So this was an article from the Denver Post, and so the headline is, should Colorado still use the term sex offender? A state board is considering new language. State sex offender management board looks to move away from labels. All right. So seeking to move away from labels that can work against a person's rehabilitation, Colorado Sex Offender Management Board plans to vote Friday to replace the term sex offender in its own guiding principles. The board is considering several new terms, including clients, adults, or individuals who commit sexual offenses, who engage in sexually abusive behavior, or who are in treatment for engaging in sexually abusive behavior, or who have committed sexual offenses. Right there, I have 10 times the amount of syllables. Like, imagine you had to say all those in one fell swoop.
Roll. So just when I say, like, all right, Mace, what type of clients do you work with?
Sex offenders.
Okay.
Everybody knows what we're talking about.
Yes.
If I say pedophiles, everybody knows what we're talking about.
Yes.
Right?
Yes.
Like, I mean, that's helpful. I mean, and my question is okay, let's say, so like relapse. Do you know where the term relapse came from? Like if we, no. well, so this is what was brought up, and I was like, okay, so here's the tricky part about this is, then when does this new thing become stigmatized? Because this term is still linked with a behavior that all of us think is you know, pretty bad, you know, like that's what we're all thinking. That's why it became stigmatized in the first place. So like, here, let's just do an experiment. Okay. So let's Google the term relapse. Okay. Let's see here. Just give me a definition here.
Right up top.
Right here?
Right above it. Relapse happens when a person stops maintaining his.
Okay, here it is, right here. Relapse. Let's pull this up right here. So we go in internal medicine, relapse or recidivism is the recurrence of a past condition. Okay, there it is. A relapse happens when a person stops, and this is again, this goes back to the drug use piece, right? Mm-hmm. This is from the Alcohol and Drug Foundation. But if I just looked up, if we look up a relapse, let's find a dictionary thing for this. Well, maybe I should do relapse definition. Let's do that. Let's do relapse definition, and then that'll help us. So it says, of someone suffering from a disease, suffer deterioration after a period of improvement.
Sure. A
deterioration in someone's state of health after a temporary improvement. Okay. So all I'm saying here is look, that's a relapse was never part of substance use treatment. That came from, it's a medical term that is exactly that meaning. Suffer deterioration after a period of improvement, which is exactly what a relapse is. So who's responsible for stigmatizing this other than the idiots that, like us, that keep saying it, right?
Yeah,
and
right.
Giving it a negative connotation, which I've always said, well, a relapse in a behavior is not necessarily indicative of failure on the client's end. It's just a relapse to a doctor would mean, oh, we need to change up your treatment plan.
Right.
We need to give you a different medication.
It's not a moral judgment.
Right. It's just we need to adjust this. So my thing is like, you're just kicking the can down the road. How long is it? Are we talking about 20 years? That reoccurrence of use is now going to be the new stigma? And then what do? Go back to relapse, or do you add more syllables to that?
Because reoccurrence of use would then carry the same stigma that relapse currently has, because reoccurrence of use gets tied with the same moral injunction that got tied to relapse.
Well, right, because
now it's these words.
Well,
now
right.
It's these sounds now that produce this feeling.
Right. Yeah. So it's these sounds like, so if you're now saying, going back to this article, if I say, in treatment for engaging in sexually abusive behaviors, that's going to be the term now, or the sounds that come out of my face that now start to provoke that. And unless it's looked at on a fundamental, like unless there's a paradigm shift,
right,
it's not going to make any difference. Like I don't understand why, like, focus on the fact that this language is there for a good reason. It's kind of like there's a really good TED talk from a guy named DJ Jaffe, and
DJ Jazzy Jeff.
Yeah. So he wrote a book called Insane Consequences, and he does
Insane Clown Posse.
Yeah, DJ Jazzy Jeff wrote a book called Insane Clown Posse. So no, DJ Jaffe. DJ stands for something. He's not a DJ, but DJ Jaffe. I think his name is Jaffe. It looks like it. Jaffe.
Yeah, that's right. That sounds right.
Insane Consequences, and basically he's talking about like how everybody's trying to be super nice about this stuff and moving away from terms like mental illness, when that is exactly what it is. Like, he's kind of pointing out, mental health sounds like the opposite of mental illness. Like, you know, like these are mental health issues. He's like, I wish I had mental health issues, you know, like I had more health. And I get it, because words do have meaning, and when you take it away from them, again, we are giving those meaning to those words. So if I increase the terminology, the meaning's still going to be attached to it if our attitudes and our paradigm doesn't change towards that.
Like retardation.
Yeah, like that. Like, and again, I mean, I think to some degree, because of how that's been used, and it's how it's been, like, you know, and it's like, it's different.
People did that though.
I get it, but it's in some ways. So if I say like a flame retardant, you can't say that. Like, what else am I supposed to say? And again, the only thing you do is add more syllables to it to make it better. You know what I mean? But I mean, like, I think the reason why that was because that was stigmatizing a group that never deserved the stigma in the first place. You know what I mean? Nobody can defend that position.
True.
Like attacking people with, like, you know, mental disabilities.
Yeah, you're a dirtbag.
Yeah. I mean, somebody says sex offender. Okay, like,
get him.
Yeah, nobody's like really defending that point, except for like this. And don't get me wrong, I understand the premise here, but I don't know if it's going to move away from this. So this kind of goes on to this part here. It says, the board, which governs the standards for treatment of people convicted of sex offenses, is far from united on the issue of person-first language in this context. Members split 8-7 in the spring, vote to adopt new guideline principles concerning language. And I think, going down to this quote, says, I think the biggest thing is research really showing us that assigning a label has the potential negative effects in rehabilitation.
Let me do some devil's advocate here.
Sure.
All right. Because I agree with you. When it comes to the way clients think about themselves, I do think there's value in them getting away from saying, I'm a sex offender. And again, it's the same wordplay, but the way that, like, just from like a client-centered approach, if a client refers to themselves as a sex offender implies actively doing it. Like I say, a farmer farms, a banker banks, a sex offender sexually offends. And the idea is that, okay, you're in treatment now, dude. And, you know, you did a period of incarceration. You're in treatment. You've changed up your peer group. You've, you know, stopped looking at pornography or whatever. You've taken some accountability. You've informed people in your support group about this. You've got yourself a stable job now. You're a different dude than the version of yourself that committed that offense. You're no longer a sex offender. You're behaviorally and cognitively different than the version of you that committed that offense. You're no longer a sex offender. You're somebody that committed a sex offense, past tense, because you're a different dude now.
Sure.
I think that, like, from a client-centered perspective, that's useful for clients to be able to, like, take away the active offender nomenclature. What you're saying, if I'm understanding you right, is that, like, this isn't that. This is like the terms that we as society use to talk about people, which then just means that we've just shifted the goalpost, and now it's a person who committed a sex offense is now going to be the stigmatized phrase because we're talking about things on the aggregate.
Well, Yes. So for clients, I think that is important. And that's something that I think any therapist that, I mean, kind of first day type stuff that if they've engaged in otherwise like an illegal, if not adverse behavior, then we want to kind of separate them from their behaviors. Like, you know what I mean? Like saying that, well, yeah, this is a behavior that you did, but all of us are not defined by the worst things we've ever done. You know, we hope that you can move past that one way or another and just become a productive citizen moving forward. Okay, fine. Let's move in that direction. But what I'm saying is I don't like, so if this board were to elect, right, so then what happens? I mean, this language has been out there for a minute. Like, it's not like that's new, what they're talking about. And some of us change up the language, you know, that we use. I've tried to get away from the word addiction for different reasons, though, because I don't like how I think it's been devalued. The value of the word addiction has been devalued by people saying that, like, you know, I'm addicted to Game of Thrones or dude, I'm addicted to potato chips. I'm like, okay,
yeah, that's a good point.
So to me, you've taken a top shelf word and turned it into nonsense at this point. And so I try to use something that's more clinical and more like moving towards like a medical kind of definition of it. So I'm fine with saying substance use disorder. I'm fine with saying that because of the almost the opposite, like the word addiction has become just, I don't know, so mainstream that it's applied to so many things that you're taking away credit from something that somebody's suffering a legitimate medical condition that needs to be addressed. You know what I mean? Now, this, on the other hand, I mean, do you think that you put those pieces in place? Well, what happens if you use the term, like a probation officer in Colorado uses the term sex offender? So then what happens? I mean, is he fired? Does he have to pay a fine at this point? Like, what happens? So there'll be language in something or other that says, you know, persons who committed a sexual offense or persons who are in treatment for sexual abuse or whatever it is. But does that really move the needle in terms of public sentiment about people who've committed a sex offense?
Not a chance.
Right? No, I don't think so at all. Yeah. So now you're just shifting the stigma. You're kicking the can down the road. Like so, I mean, from a client's perspective, yeah, they deserve to realize I'm not my worst behavior. I can move past this, and I have other options in my life. You know, provided that I'm going to serve my time, do this, I'm going to move on. But I just don't know. I don't know if you're really making a big difference here, other than I did this and I get to feel good about it.
That's what it is.
Yeah. Which I mean, fine. I mean, that's cool too. If you did that and you feel good about it, good for you.
So like some version of virtue signaling, kind of.
Yeah. I mean, I don't know. You know, I don't like calling. I get it to some degree. I don't like calling dudes felons or inmates or you know, convicts. I don't like calling them that. You know, their name works. you know, like I agree with labels. I don't. But I mean, I just like simplicity too, and I like being able for everybody to get on the same page. And sometimes when you pollute that, and there's professionals working in this field, it's almost like I guess the drawback, and maybe this is me being lazy, is like it takes you a longer time to get everybody on the same page in terms of what we're staffing and talking about. So I don't know if that's any significant consequences associated with that, but yeah, it's definitely kind of tricky. I don't know.
Just kind of misapplied. Good intention, I think.
Yeah. This is kind of a funny cap I saw in here. Says, ironically, even if the board votes to scrap sex offender, it cannot change its own name. The legislator oversees the sex offender management board and have to agree on any change. Lawmakers earlier this year considered but did not pass a broad reform bill, among other things, would have updated state statute to eliminate the term sexually violent predator. That's a term used to describe a subset of people under the sex offender label, and one that the board agrees is outdated. But so they can't even change their own. You know what that reminds me of is that it's the Substance Abuse and Mental Health Administration, SAMHSA, but they say it's substance use disorder, and
even though it says substance abuse in the name. Yeah, that's funny.
You can't get away from it. Yeah, it's like you bury it. You dug. That's what I'm saying. Is you've kind of
case in point.
Right. You can't move away from these things because this is now defined. You know, and for good reason. You know why these things are there. So really, I think a shorter path would be educating and changing hearts and minds associated with the like what that words means and the paradigm shift as to what we're talking about versus just changing the language and somehow thinking we're all going to just, like, I never thought about it that way.
Exactly.
I don't think that's going to work. That's what I'm saying. So
let's keep language efficient.
And at the very least, if you're going to change it, make it less syllables. Like just make it one word. Real simple, but invent a new word and then say, here's what it means. And I'm fine with that. Yeah. Totally cool. So, all right. Is that all we have to say about this stuff?
That's it, man.
I think so.
All right.
So until next time, folks, we'll be on the prowl for new sex offender news.
That's right.
So, wait, hold on. Persons who commit sexually abusive behavior in treatment and in recovery, rehabilitation, empathy.
For minors attracted
For
people.
minor attracted people. Oh, okay. All right. And thanks for listening to the Guerrilla Social Work Podcast with your hosts, Jeff Moore and Mace Warren. We hope you enjoyed our deep dive into all things related to forensic psychotherapy. As always, you can head over to utahsbesttherapy.com to check out our program and check out all the links and resources in the show notes. You can find us on Apple Podcasts, Google Podcasts, Spotify, Audible, and wherever you prefer to get your listener fix. Please share this episode with your family and friends, and don't forget to subscribe and leave us a 5-star rating, which really helps us out. You guys are awesome. We'd like to stay and chat longer, but we're lying. Good night.